Welcome back to this third lesson on the temporomandibular joint for the team. And right now we're going to spend some time talking about function and dysfunction of the temporomandibular joint. Jeff Okeson has a great quote that I love that says, "To understand dysfunction, you first must understand function." And so let's go into that. I alluded to at the end of the last lesson that things, when they move in harmony, it goes well together. And really what I want you to see just from this photo right here is that, again, we've talked about how the ball actually comes out of the socket. So when we open our mouths, the ball comes out of the socket, the disc actually comes with it, and the lateral pterygoid pulls everything forward. Mostly what I want you to see in proper function, at least for now, is that the disc itself, that blue piece, that biconcave cartilaginous piece that's fat on the backside and fat on the front side, it moves with it. And so as the ball comes down the socket, that cartilage comes with it, and when we close, everything goes, the ball comes back into the socket and the disc moves with it. And really, that is proper function of the temporomandibular joint, or that's what we're going to leave it as for now. What I want you to remember, though, is that absence of pain is not always indicative of optimal or good health. So even though a patient walks in and doesn't complain of discomfort of the temporomandibular joint, that doesn't mean things are always functioning very well. So let's spend a couple minutes talking about things that don't go well in the joint, or dysfunction. And we'll start by talking about the disc and abnormal disc relationships. One of the most prominent things that go wrong or go off a little bit is when the disc is actually forward. So it actually starts forward of the condyle, or anterior disc displacement. So the ball then actually has to pop on to the socket. And there's a lot of reasons that could happen. Remember, we blame everything on that darn lateral pterygoid, right? And so is it that the lateral pterygoid has been pulling forward and has pulled the disc off a little bit? And by the way, might that be caused by the way the teeth are coming together? Stay tuned for more on that. But regardless, if the disc is forward, it can create some problems. So what I want you to see here is what happens when the disc actually starts forward of the ball. And look at that ligament in particular, because this is when the ligament actually starts stretched out. It's always stretched out because the disc is always forward of the ball. And when we talk about the exam in a couple minutes, we're going to talk about what happens to that ligament, or how we can identify that this might be the case, that that ligament is always being pulled forward. But when the disc is forward, it can sometimes pop back on, and so we call that with reduction. This is the audience participation part of this course, if you will, and I hope you do, because it really helps to experience this when you think about what's happening with the disc. And so when the disc is popping, or the disc starts forward of the ball, what happens is it's not always the whole disc, because when you look at these pictures, it looks like the whole darn disc is popping off. And what I want you to think about is that the entire disc goes over the whole ball and socket. But really, sometimes it's just this little outside part, if you can see that. Just a little outside part that starts off. It's not the whole disc that is starting off of it. And so if just a little bit is off, as we start to roll down and the ball comes out of the socket, it'll pop back on and continue to go. So again, just a little bit outside, it'll pop on and continue to go. And then when we close back down, sometimes it'll just slide back off. So when we're talking about clicking and popping joints, oftentimes it's just a teeny tiny part of the outside that, again, it starts forward. So when somebody opens, you hear a little pop, pop. That's the disc getting back on. And sometimes you hear it pop back off, and sometimes you don't. But that's what we call reduction. So it pops on and it pops back off. It doesn't always hurt. In fact, it usually doesn't hurt because it's that piece of cartilage that doesn't have nerves or blood vessels. So I hope that makes sense to you. But sometimes part of that disc actually doesn't pop back on. It actually gets stuck in front of it, and it's oftentimes a little bit more of the disc. So again, let's go to the 3D model, my hand and fist here, and that is where basically if it starts forward and you try and come down, but it can't pop on, and it just gets squished in front of it a little bit, and so again, it doesn't reduce. And oftentimes that's when somebody will be locked closed because the ball can't continue to go down because that cartilage is squeezed in front of it and they can't pop on. And although it's oftentimes also not painful because it's just cartilage, it's obviously uncomfortable and scary, and it has a funny feeling when it does pop on. But that would be a without reduction. Oftentimes that's a locked closed position. So as you can imagine, with the disc being forward, starting forward on a regular basis, what can cause discomfort is the ball then not being able to squeeze into the socket with the disc in between it, but it's got to squeeze into something, and it gets into that retrodiscal tissue that we talked about early on. It has all the nerves and blood vessels. So when the ball gets shoved up into the socket and there's retrodiscal tissue there, that's going to cause some discomfort. And so we've looked at function of the joints, proper function, and we've looked at dysfunction, really mostly just talking about the disc and the relationship of the disc and some pain that can be associated with the retrodiscal tissue. So I hope that helps you understand function and dysfunction of the joints, and I'll see you at the next lesson.